Hi, good afternoon and welcome everybody. It's Mark Lever here, Chief Executive of Helpforce, and I'm absolutely delighted that you've all managed to find some time in your busy schedules to take part in our webinar today, where we're going to focus on a topic that I know is really important to a lot of you, and that's how do we speed up the onboarding and induction of volunteers in these challenging times. And we've got three speakers that V will introduce shortly, who will be able to share some insights and share some work that they've been doing on this topic. We're also going to be joined by Jane Fox a little bit later, probably in a few minutes, and she'll be listening into the conversation, and she'll also be there to answer any specific questions you have, particularly around guidance and good practice from NHS England, because as you know, Jane is a key part of the NHS England team and the deployment of volunteers, and she's been working really closely with Helpforce and with others to make sure that there's as much support and guidance from NHS England as we can get. I guess since the last webinar, one of the most important developments has been the guidance which has come out from the government and NHS England on supporting volunteers within hospitals. I'm sure you will all have read that. For those of you who haven't had a chance to see it, it's on our website on the Learning Zone, and we've created a COVID-specific area on our website now where we're sharing the roles which have been developed, which we've picked up on, have been developed by other trusts. So you've got details of the roles on there. You've also got details of guidance and other forums for people to discuss particular challenges that they're facing, and we hope you find that useful. I've got a couple of questions for people, and it would be really useful if you could email your feedback to us. Probably the best email address is network@helpforce.community. That's network@helpforce.community. The two questions are, firstly, we would really like to know if you're actively recruiting at the moment. The reason for this is that we're getting a number of corporates who've got furloughed staff who are interested in volunteering within the hospital and are keen to be matched up with trusts who are recruiting. So particularly we know that Marks and Spencers have been pushing this message out to their staff, and we also know that we've got a number of British Airways employees who are interested, and I think there'll be more and more people coming forward to offer to volunteer. So it would be great to be able to match you up with potential volunteers in your area. So if you could email us and just let us know if you're actively recruiting, and then we can share that information and create a match. The second request is that we've been doing some work with PwC, the consulting firm, in a couple of trusts in South Warwickshire and in Chelsea and Westminster, where their consultants have been working with the volunteering teams to actually explore volunteering resilience at this time. And what we mean by that is looking at those COVID-specific changes or COVID-specific roles and procedures that need to be embedded, which will enable the trust to be able to process volunteers, onboard volunteers more quickly as the need grows. And what PwC are going to be doing with Helpforce is to develop, if you like, a resilience checklist, just a series of very simple, short questions to identify where you may or may not need extra support. If you're interested in a very short telephone call over the next week to explore that checklist, to actually run through that checklist with us so that we can help you identify where there may be support available, and actually where we might be able to offer PwC or similar consultants to come in and support you in the way that we've been doing at Chelsea and Westminster and South Warwickshire. We would really love to hear from you. So again, the email address is network@helpforce.community, and that's just to have a quick call, probably 15 minutes, just to explore volunteering resilience in your own trusts and to make sure that you've got all the support that you need to do that. So if you could email us either whilst you're on this webinar or after the webinar, that would be really helpful. So thank you for that. So two things: let us know if you're recruiting, and secondly, if you'd like to be part of that volunteering resilience survey. So enough from me. I'm now going to hand over to my colleague V, who is going to introduce the first of the three speakers.
Thanks so much, Mark. Before we start, I just want to let you know you could use the Q&A option to ask any questions, or you can raise your hands. So those functions are on the bottom of the window. So when you raise your hand, you're allowed to talk. So please feel free to use two functions to join the conversation. And the first one we have is Eloise from Chelsea in Westminster. So Eloise, can you speak now? If you can unmute yourself.
Hello, did that work? Am I unmuted?
Yes, you are unmuted.
Okay, perfect. Yeah, so I thought it'd probably just be worth sharing a couple of the things that's been going on at Chelsea and Westminster, and I apologise if you're used to hearing from Joe Crook. Unfortunately, he is Chelsea and Westminster's volunteering service manager, but unfortunately he has been taken down by COVID himself. So unfortunately you have me. But I thought it would just be good to run through probably three of the key things that are happening at Chelsea right now that might be interesting for your other trusts to think about in terms of, you know, what you might be able to do and how you might sort of be able to push your volunteering services in this kind of unprecedented time of demand. So the first thing that would be really great to kind of just give you a bit of an update on is the use of our volunteers in clinical areas. So I know over the last sort of few weeks, lots of the guidance has been changing around, you know, where we can use volunteers, what's the safe protections that we need, and, you know, where is that demand sitting. Obviously lots of us are used to using our volunteers in patient-facing areas, and for many trusts that are still running their volunteering services, that kind of activity has you know, usually dropped off, and that is what had happened in Chelsea and Westminster. So sort of the days pass so quickly now, but at the end of last week, basically taking the decision to not put our volunteers onto ward areas anymore. But yesterday we basically got confirmation from the chief nurse at the hospital that actually we will be looking to put our volunteers back onto wards, focusing primarily on two kind of roles. So one, the traditional sort of ward helper role, so, you know, helping run things around the ward, do lab reports, maybe help with reception, and then the second part was about specifically looking at how we can use volunteers to be sort of bedside befrienders of our patients who you know, might not be having any visitors right now. So we're currently working through exactly what that will look like, but basically the agreement that we've got is that our volunteers would have exactly the same protection as our staff in those areas, so have access to the same PPE, we treat them in the same way, you know, they've been received the same training, and what we're looking to do is running a small trial on one of our experienced wards with a couple of experienced volunteers who've expressed an interest to you know, to go volunteering back on wards, aware that obviously, you know, some of them have COVID on, and testing out those two roles to see how they work. You know, if the wards are still happy to use people like that, how our volunteers feel about that, get a bit of a view of, you know, other patients, you know, they feel comfortable with having volunteers on the ward, and having, you know, really honest conversation after we do that trial with those people to say, does this kind of work? You know, because I think this is a really exciting opportunity, but also, you know, if it doesn't work, then we don't want to push things down people's throats almost. So next week, that's what we're hoping to sort of kick off a trial for, and fingers crossed we will have our volunteers back on the wards, really providing a valuable service to the frontline staff and to our patients on those wards. So that's just, you know, it's kind of very new. Like, we've got, you know, it's the conversations are going on for a while, but we got the confirmation kind of yesterday, like lunchtime, that we could start exploring this again. So I just thought it would be an interesting thing to start thinking about in your trusts. Kind of the second area is thinking about really how do we actually manage all this new demand that's coming into the trust. So Mark touched on it previously, where you know, and you'll all be experiencing the same things. There's hundreds and hundreds of offers of support, money, food, you know, people. How do we best utilize that in the volunteering service? And I think, you know, what's kind of been really clear in Chelsea and Westminster is it's really, really important to number one, have kind of like a communication route for those offers in. So who is there? So what we've done is basically set up like an email address where these offers can be sent to, and then there'll be someone kind of sort of triaging that mailbox and linking the right people into those offers. So if it's offers of food, linking that into the estates and facilities team, and then as a volunteering service, we've assigned some of our volunteers to the estates facilities service, so they have the additional workforce to help meet that demand. But just having really kind of clear communication routes are something that we found really, really important, because we're all going through it. Guidance kind of changes every 5 minutes. There's loads of different offers, and we just need a bit of clarity. So creating kind of that single point of contact at which someone can triage is really, really has been really, really helpful to the trust over the last kind of few days that we've got that up and running. And then I think the third part is, we know we've got all of this demand, and we know that the kind of roles that we've got the people are doing are changing. And, it almost goes back to the first point of, we need to be pretty sort of agile and responsive in what we do when we are sort of attracting and onboarding our volunteers. So, and I'm sure you've all experienced the same thing, the volume of applicants has gone up quite significantly at Chelsea and Westminster, and basically what's happened is we've just made sure that process is really streamlined, and we've got some additional support from some of the corporate teams who have staff who are self-isolating at home to help conduct telephone interviews and our telephone references, so we can get those applicants through the process as quickly as possible, and also helping us run some of the so using Zoom to do all our training. And that's been really important for us to be able to make sure that we can meet this, we can sort of satisfy our supply by making sure that we process them through quickly and keep them aware that the specific role they might be doing is likely to change quite a lot, but actually the most important thing is getting them on board, so then we can as soon as they're ready to start volunteering, they can go onto an app that the trust have to sort of register their availability, and we can assign them out to that ever growing demand. And sort of really helpfully for that, obviously on their first day, basically there's a sort of a volunteering hub at both Chelsea and Westminster sites. All the volunteers can come to one space. It's a big room, there's lots and lots of alcohol gel on it to make sure everyone kind of stays safe and observes all the bits. But it's quite a helpful place where everyone can come into, know that that's where they can get all their key information if they've got any questions. It's kind of their base when they get into the trust, which is kind of helping mitigate some of the concerns we might have had where previously we were doing big inductions where people all met each other. This still provides kind of help get through the process quickly, but then still provides them with that support, that in-person support once they are on the ground that we may have sort of reduced in the initial application stage. So yeah, they're kind of like the three sort of big things that we're doing at Chelsea that I thought would be quite interesting to share with other people. But yeah, I'm not. Yeah. Can people ask questions on this, or do we have to?
We do have quite a few questions here. Eloise, are you online? Okay. We have a question from Laura here. She said at her trust they have no visitor policy at the moment. Mm-hmm. And that her trust was worried about allowing volunteers back into wards in this context, and pushback from families given that they're not allowed to visit their loved ones. This could be perceived as quite unfair. So how have you overcome this at Chelsea and Westminster?
Yeah, so actually we haven't because we were only going to trial on Monday, we haven't necessarily got any feedback from sort of family or friends and what their perspective on that might be. So that's that's a really important thing for us to actually think about, and that's especially why we want to kind of get the feedback from patients. I think the important thing is basically we're seeing our volunteers and our staff as one body right now. So when it's not necessarily being called out that these people are volunteers and it's like a two-tier policy. We are completely seeing them as part of the core trust workforce. So they're there to help provide that frontline service, and we're kind of badging them as as they are frontline staff along with our normal staff. It just happens they're not being paid. So that's really helpful actually, because that's something that we should definitely think about when we're getting sort of getting the feedback and running that trial.
Thank you. And there's no question from Joanna. She asked, please, can you send me details of the app you suggest in Westminster? Could you give a detail?
Yeah, so the trust uses an app called Better Impact. I wasn't there when it was set up, and I don't know the ins and outs of how it runs, but basically it's an online system where you can manage the onboarding process and then, put out shifts that people can pick up via an app. I think there are lots and lots of different types of apps that you can use. Appreciate, some of them may cost money, and they'll take a bit of time to kind of stand up. So I think there's other ones called like Slack and things like that. But even just having like a live Excel, or like if anyone has like Microsoft Teams or Google Sheets or things like that, having some kind of interactive form where people can see live kind of where responses are coming in and put availability down is probably if you don't have anything, have something like that is probably a good starting point.
Yeah.
I think can I just add something to that? Building on what Eloise was saying, I was talking to the partner at PwC that's supporting the placement of people like Eloise into Chelsea, Westminster and South Warwickshire, and they've identified that some form of a digital tool to match and track where volunteers are within the hospital, if volunteering teams don't have anything, is something that they could perhaps develop at PwC and share and give to the trust that would be interested in that. So as part of the support that they're giving to volunteering within hospitals during the COVID time, that's something that they're thinking about, that they might be able to develop so that people can access that. So again, as part of that volunteering resilience exercise, that's something very tangible that they're keen to develop. So that's point one. Point two is that Eloise was mentioning that lots of companies are coming forward with offers of support, and NHS England have been quite overwhelmed by the matching of those offers with the needs in individual NHS trusts. So they've asked Helpforce to try and act as a bit of a filter of those offers and try and communicate those offers out to trusts more widely. So with Deloitte and Accenture, who've done all the clever stuff behind the scenes, we've developed a platform called Helpforce Assist, and that enables trusts to go on there and log any requests or requirements they have for goods and services which relate to staff and patient health and well-being. So it's not necessarily the place for volunteering, offers of volunteering, but for goods and services which might support the health and well-being of patients and staff. But it also is a place where companies are starting to upload their offers, so we can have a greater visibility of what the needs within the trusts are, but also a greater visibility of what companies are offering so that we can match the two. So for instance, I'll just use one example. Virgin Mobile came to us and they've offered 1,000 mobile phones for patients who are unable to reach out and communicate with their families. And they've said they will bundle those up into 10 bundles of 100, so 10 trusts can access those. We've had requests from 4 or 5 trusts so far, but actually by having that platform and giving visibility to some of those offers, trusts can go in, and all the people on this call will be able to do that, can go in and make requests, and we can match those requests with the demand there. So do use Helpforce Assist. Again, that's, if you go to our website and follow the links, you'll find it, but if you want to get there directly, it's just helpforce.community/assist, and I'm sure V will send out some of these links that we've mentioned at the end of the meeting. Anyway, so sorry for interrupting, V, but I just wanted to add those two.
Yeah, of course. Eloise, we have more questions for you, but we'll come back in a bit.
Yeah, of course.
Yeah, give me a second. Let me just raise your hand.
V.
Yeah, sorry.
V. Sorry, V, it's Jane Fox. I just wanted to jump in talking about the role side of things. So it's really great that Helpforce are working with Trust to test out some of these roles. What we are trying to do from the centre in terms of NHS England is look at the different roles that are emerging, that are required for sort of supporting the COVID-19 response, and make sure that we've got those cleared from a national perspective in terms of the PPE implications, infection control requirements and expectations, etc., and put some national guidance and context around any roles that are emerging. So I think it was just helpful to sort of make sure that you understand we're looking at this from the national perspective as well, to make sure that volunteering is both safe and effective and can maximise the contribution that volunteers can make during this time.
Perfect. Thanks so much, Jen. We've got Leslie here. Raise your hand. Leslie, you online now. Would you like to speak?
Hi, can you hear me?
Yes, I can hear you.
Hi, yeah, Leslie Grant here. I'm at Voluntary Action Stoke, so at the voluntary sector infrastructure organisation in Stoke-on-Trent in North Staffordshire. Just to say, we've teamed up with our local council. I'm aware that obviously lots of this is around hospital volunteering. We are in the position where we're looking at community-based volunteering, but we're trying to support our primary care networks around the social prescribing agenda. So we're coming at it from that element of health. And 3 weeks ago, we teamed up with our local council and put together a website where people could add offers of support and requests for support. And that was both individuals and organisations. And we have a very, very small team behind the scenes who do exactly what somebody was just mentioning. I think perhaps Eloise was saying about when you've got those offers of support coming in and the requests for support, somebody's there doing the matching behind the scenes and making sure that people actually do get placed appropriately. And we have a team called Vintage Volunteers that works as part of that, who they've been doing that for quite a long time anyway, is that matching of people who want to do volunteering with an appropriate organisation or placement. So just to let you know, there's stuff out there kind of already. I don't know if there's anything that people can kind of ask Stoke City Council for in terms of, you know, the website platform is there, the back end structure is there in terms of the matching of volunteering to requests for help. But also, I'm also seeing a lot of stuff coming through the social prescribing national forums about social prescribers who are out there trying to access the NHS volunteers. And I think it's getting quite confusing about where they need to go in. I think it's possibly more straightforward in a hospital setting because, as you say, you can view your volunteers as part of your overall team. In community health, it's kind of a little bit more muddled because there are lots more fingers in the pie. So just to kind of put that out there, but to say to people, do ask, do find out what everyone else is doing, because there's quite a lot going on already.
Perfect.
Okay, does that make sense?
Yes, it's very helpful.
Yeah, it's Jane here again. I think that's really helpful in terms of remembering that obviously the focus of some of the discussion today is around hospital trust, but one of the really key things is that actually that link out, the support back out into the community is really essential. And I'm aware that I think all the major councils have set up sort of volunteering platforms again to try and match local offers of volunteering with local need, as it were, in terms of people out there in the community. And the other thing to just bear in mind is that the NHS responder volunteers that have been made available and come online recently, they can actually be referred into by social care as well. So they are also there as a resource, both helping people be discharged from hospital settings referred in by trusts, for example, but then also can be supported out in the community through the NHS Volunteer Responders Scheme alongside the other schemes. And at this time, I think it's really important to say this is not about where do you go or who do you go to or ownership of volunteers. It's about actually there are people there to help. When nobody's trying to replace anybody else, they're all equally important, equally valuable, and there's plenty of work to go on. So plenty of things that need doing. So it's really important that we cross-refer and use the resources in the best way that we can.
Absolutely.
Thank you.
And certainly that, I mean, that's our experience, because obviously our council are wanting to, it's the element of, if you've got a volunteer and you need them to potentially be going into something that's clinical or semi-clinical, they have to link in and work out how that person's going to be appropriately trained and equipped and so on. So it's starting to, it's really encouraging actually that things are starting to kind of move in the same sort of direction.
Thank you,
Thanks.
Leslie. And next one we have is Ruth Patterson from West Hurd. Give me a second. Ruth, can you speak now?
Hi everyone. I missed the very beginning of the call, so apologies if I'm repeating anything that anyone's been talking about. I've heard that a lot of people obviously got kind of community setting, so some of what we're doing here might not be as relevant. But basically, for anybody that was on the call last time, I kind of updated the West Herts Hospitals Trust, so Watford Hospital, Watford General, which I think everybody's probably seen in the press. We've been through quite a tricky time over the last few days. We are very much using volunteers, and we're operating a response volunteer model. And I will share everything so it can be shared on the Helpforce Learning Zone, so that you can see our role description. We've very much simplified things. There's just one role description, so one role which is covering a multitude of tasks. And we are finding that actually all our volunteers come into a centralised hub. Our recruitment processes were very similar. We've already had a very streamlined approach where everything was already done in-house, right through occupational health, self-declaration forms, things like that. We have actually upped our training for our volunteers. I know a lot of people have reduced their training, and I appreciate that it is tricky. We felt quite strongly that at the moment, these volunteers are people coming in off the street who perhaps have absolutely no experience in a hospital environment on a good day, but right now they are seeing very distressing things very regularly. And so we have got a 3-hour training session, which we will also work out how we can share with everybody, and you're very welcome to have a look and adapt that and use it in your own trust if you think it's helpful. And please do, everything we've done is very rushed. If anyone's got any feedback or suggestions for improvement, we'd love to hear it. But yes, we're very much finding that training has been absolutely imperative for preparing these volunteers. They're very, very much so. It's quite emotional, it's quite tricky, and it's a very fast-paced environment at the moment. We're also finding we need a minimum of 1 member of staff at all times in the hub to be there as a constant source of support for our volunteers. We have asked for the trust to see if we can get some redeployed staff to support us to back this up. We're also about to undergo a recruitment campaign, which has been delayed a little bit as our comms team have been rather busy, but we are hoping to recruit more. We've currently to date been running this model. We started last week. We opened the hub on the Tuesday. We'd had the first training session on the Monday. We have 20 volunteers trained and another 20 this week. So we're up to 40 volunteers. We're running 3 shifts a day. Each shift is only for 3 hours. We've been quite strict on that because we found for volunteers 3 hours is more than enough time. It is quite heavy going. We're happy if they want to do 2 or 3 shifts a week, but 3 hours is enough. They're doing a lot of running around, a lot of moving things backwards and forwards between areas, and it's quite intense. So I think that's kind of a little bit of a summary of where we're up to. I hope that's helpful for people, and obviously, as I say, we'll try and share as much of what we're doing as we can.
Thanks so much. Will you just say how fast do you think with this streamlined process does it take to get volunteers to do?
So our recruitment process, from the moment that a volunteer says that they want to volunteer with us, we receive, unfortunately we've not got the most high-tech system. We have just got Better Impact, but we're not ready and going with it yet, which would have been great. Unfortunately, we're not there. So we still have a paper-based system, but we have got like a PDF of our application pack, which again we'll share, which comes through to us. We invite them in for a DBS check. We're still doing that face-to-face. Now, the reason we're doing that is because it's not just a DBS check. We go through the whole process. We make sure they're understanding what they're coming in for. We obviously meet with them at a distance, so within the 2 meters, and observe social distancing. But actually, this role is coming into an acute hospital. So I feel that the idea to do the DBSs remotely it very much makes sense in the community. These volunteers are coming in. This is partly, we don't call it an interview, but it's very much an interview for us to make sure the volunteer is appropriate, and for that volunteer to make sure this is right for them. We've also got a COVID agreement with the volunteer, which makes it really clear that they understand they're not to come if they're unwell, or one of their family or the household is unwell. Makes it very clear that they are not in a high-risk group, and makes it very clear that we cannot promise they won't come into contact with the coronavirus. So when they come in to meet for that DBS session, there's a lot of discussion around that to really make sure they're right for this role. Once we know that's okay, we undertake the DBS check. We already have all the Statman training online because we use the same online system that staff use. So I know a lot of trusts have e-learning for the Statman training. So that's the system we already had in place, which we're continuing with. We then get them to sign an occupational health declaration at that point when they come in. So they've signed the COVID agreement, they've signed the occupational health declaration, they're happy with the role description, what they'll be coming in to undertake. We take their photo ready for their ID badge as well. So we kind of do it all in one hit when they come in. Then it's the DBSs are very quick at the moment, they're back within days. So it's then up to the volunteer who goes home and for them to complete their online training, which they can probably do in around 3 hours. Some of the younger ones do it much quicker. Some of them like me maybe take a bit longer. Once they've completed the online training and their DBS certificates come back, we're then pretty much ready to go. Oh, we request references as well. So when they come in for their DBS check and their interview kind of session, we sort of make sure, hang on, the people you've given references for, have we got an email address? Are they there? You know, if it's somebody younger, it's not a college or school where they're perhaps not there. So we make sure we have those conversations. So the references are back pretty quick. And in theory, they can be pretty much registered and ready for the next cohort of face-to-face training, which at the moment we're running once a week. So we can have them up and running pretty quickly.
Perfect. Thank you so much, Ruth. Can we just have someone to raise a hand here? Just give me a second. Katie.
Can I?
Oh,
sorry.
Yes.
I was just going to jump in and ask, I'm interested in the COVID agreement that you're putting in place. It'd be really helpful if you could share. I think we've the existing volunteer agreements sort of are sufficient to cover, you know, coming into contact with potentially infectious diseases. But I think the fact you've put a specific COVID agreement in place.
Yeah, no, we'll definitely share that so that everybody can see that.
Yeah.
Yeah, very
explicit.
Yeah.
It would be really helpful if you could share that, I think, just so we can have sight of it and think about it in the context of our guidance that we're thinking about.
Thank you so much. Katie,
thank you.
Yes.
Okay. Yeah. It's Katie Hurd here from Torbay, and we are an integrated acute, community and adult social care trust. So we're trying to cover all options. So I've just got a couple of questions to share or to ask the group. Firstly, whether anybody is using their existing under 18-year-olds, and if so, have they drafted any specific agreements about those? And then are they recruiting new ones? Because we've been generally under the pairs work, we are doing 16 to 25-year-olds. And then the second question is whether anybody has had any success requesting volunteers via the RVS, because we have tried to log as requesters of volunteers as soon as the guidance came out, but haven't had any response yet. And I don't know whether I've just missed it. Have we had any formal notification as to what actually the recruitment processes are for those? Because I've only had it anecdotally from friends who've applied, and it doesn't seem as robust as that which I would expect to do for our volunteers.
Thank you so much, Katie. If anyone has an answer for Katie, do raise your hands or put in your Q&A. Jen, do you want to say anything? I think Jen's locked out. That's fine. Sorry, Katie. I think Fiona has just raised her hand. She probably has answer for you. Kate, Fiona, you are live now.
I can't.
Yes, we can hear you now.
Oh, you can hear me? Oh,
Yes.
that's brilliant. I didn't think my mic was on. As I understand the RVS scheme, it's not a brokerage scheme. So volunteers are not being recruited and then passed on to another organisation. They remain volunteers with the RVS and recruited to one of 4 defined roles, which are all in the community. 2 relate to transport. One is transporting patients, one is transporting goods, one is about shopping, and one is a kind of telephone check-in and chat.
Yes.
So I don't think that they will pass them on to the NHS. It might be worth a conversation about how that can dovetail in with.
Can I interrupt? I'm clear of the 4 roles and what they are, and we work very closely with our voluntary sector partners. So 2 of the 4 roles, they are trying to access 2 of the 4 roles. Say we're a community trust as well, and the adult social care trust, and we're also dealing with so we are dealing with the council, because we act on behalf of the council, for the people who are shielded. So we have particular requests for particular things, but we haven't been able to be registered at all yet, and neither have the voluntary sector partner. And I realise that so the people that they are potentially accessing will be our vulnerable groups, but I don't think that the checks have been as full as we would expect for people who are dealing with vulnerable people.
Thank you, Katie. We have Eloise. I think she might be able to help you. Let me just unmute you, Eloise. Yes, you can talk.
Hello. So one thing I would just say, so I appreciate you. I can't really answer the question about whether or not the how the process was when they onboarded people for RVS. That kind of sits with them. But the thing that's basically happened in terms of referrals, they did sort of make their website go live yesterday, where healthcare professionals basically have to refer in individual patients to the service, and it is I'm just trying to find the website. I've just got the guidance up, but basically there is a sort of an online patient referral form, and that's how you refer into the service. So what we've done in Chelsea and Westminster is actually kind of given that over to sort of we're having the discussions with the discharge teams to say, actually, this probably sits with what you're doing, and you might want to build it into your pathway. And again, what we're doing is trialing it with one ward when people are being discharged, to say, actually, as part of like a week worth of discharge on this ward, we know X, Y, and Z people might need help back in the community, or we need help with patient transport, and we're going to refer them in patient by patient and see how that comes back. I appreciate none of us really know how that's going to work yet, because obviously it only technically went live yesterday, but it's a bit tricky, because it is it's an individual patient by patient referral you have to make. So like what we've kind of landed on is it probably doesn't sit officially within the volunteering service, because actually we have nothing really to do with the volunteers. They're providing that. It's more a referral point, so it might sit better with some of your sort of clinical or discharge teams to have a look at how they can utilize it and how it works for your organization, because again, it will depend on how many people there are in the area around you who signed up to do X, Y, and Z job and are live at a particular period in time. So that's why we're just trying it with the one.
That might be a good way of
right now.
Doing it. Thank you. And does anybody have any idea if we will get an idea as to how many volunteers there are locally? Because what we've discovered is some of the volunteers have registered as volunteers with us, with Good Sam, and with our voluntary sector partners. So it's getting a bit messy.
Yeah.
So we've got Alison here. Sorry, I think she has an answer. Alison, you want to speak?
Yeah, sorry. Hi, my name is Alison Smith, and I'm doing sort of a dual role with Helpforce and Royal Voluntary Service. So just to reassure you, as Eloise said, we officially did go live yesterday. So we have had obviously significant referrals come in through our call centre and through the referral portal. We have cleared some of the backlog of the 750,000 volunteers. So we are in the process of sort of matching. that. It's just the volumes that have come in.
Yeah, I appreciate that.
Yeah, and but we are, because we're doing it digitally, it should happen sort of quicker. But with some of the referral forms, there's a lot of kind of missing information on either patient address, things like that. So that's taking a little bit longer to process. But just to say, they are on top of it. I think we are slightly struggling with, obviously we are, working with a range of the call center, and then sort of Good Sam and data is sitting sort of, in various places that we're then trying to pull together and really kind of understand the geographical spread, the role profile, and then sort of map that on to what we know around kind of need and future need and referrals. So all of that is kind of happening behind the scenes. And just to say, where there's much more patient-facing roles, some of the community transport, that does require sort of a DBS check and sort of further checks in the system than, say, someone just dropping shopping on someone's door. And just to say, most of the people that have stepped forward, about 90% of the roles, are more the community support, where people are doing shopping or dropping off prescriptions. The other 10% is cutting across those more transport roles. So it might be something that we need to go back out with a call for those roles, but obviously there's just a lot to process at the moment. I hope that's helpful and reassures you that we're on it.
That's really helpful, and I can appreciate it must be absolute nightmare. I'm struggling with the hundreds of volunteers we have. When you have hundreds of thousands, it just doesn't bear thinking about. So good luck with that. It's appreciated.
Good problem to have, right?
Thank you,
Alice. Yeah, Alison, it's Jane Fox. I think the other thing that's worth mentioning, is that obviously the other thing with the Good Sam, people are obviously putting themselves forward to volunteer through a variety of channels, and clearly if they are called onto a job, it means they're not available for other things at that time. One of the things with the Good Sam app that they can do is actually put themselves as available or not. Yes. So they can switch themselves on and off, which is really helpful, because people who work, for example, and are working in the daytime might want to help and volunteer in the evenings, so they can make themselves available on the app just for the times that they can be available for. And if they get called, they get called, and if they don't, they can switch themselves off again later when it's not appropriate. So again, I'm back to that point. It's not about anybody trying to claim, there are volunteers and you can't have them. I think it's about understanding that people will help wherever that help's needed, and there are several channels for them to offer that help through at the moment. And from my perspective, that's a brilliant thing and a brilliant opportunity.
Yeah, no, sorry, just to say, I'm not saying that we should have some volunteers and they can't do anything else, etc.
No.
But I think it is really good that people can do that and can control when they're called. I suppose another question then is, if we need a volunteer, if the discharge team need a volunteer at 4 o'clock this afternoon, how does that work with people's availability? Or are there a couple of ways that people log their availability? Sorry, I don't know what the process is.
Katie, I think this question is very specific for the Good Sam. Is there any?
Okay, sorry, yeah.
Because we have a few people to raise their hand.
I'm happy to be emailed after this, if that's helpful.
That would be fab. Okay, thank you.
We have
Alison, can I just ask if there's any RVS guidance that you could share with us? We'll put it up on the Learning Zone so that everybody can have a look.
I think a lot of that goes out through NHS England. Jane,
the national guidance. Yeah, the national guidance has been shared with Helpforce and should be up there, should be available.
Yeah, it is. But some of it is limited.
Sorry, we just have Catherine Jowett here. Catherine, you're unmute. Would you like to speak?
Yeah, I mean, it was just another Good Sam NHS Responder question, really. So it'd be great to have Alison's email. And it is just around that assurance of, if we are referring people, how do we know how many volunteers there are locally and that actually they have been picked up? Because I think our fear locally is that we don't actually know what this looks like. We don't know what support's available. And the last thing we want to do is to revert for vulnerable people, assuming they've been picked up by the NHS responders service, but actually haven't been. So I think it's just some of that assurance before we start referring people. We need that assurance in the system and that to be communicated.
We will get back to that. I think Alison will let us know what's happening with that. We just have a next person lining to speak. Is Lucy Reynolds. She will speak about her experience with fast tracking. Lucy, can you speak now?
Hopefully, if you can hear me.
Yes, we can hear you now.
Oh, brilliant. Well, I work for a local hospice in the Northwest, and at the moment we're not able to have any of our volunteers volunteering in the hospice itself or in the retail shops or across the whole organisation. We've kind of had to pause it. So it was really about, if we can signpost volunteers to hospitals or NHS trusts that need the certain roles and skill sets. So we have volunteers who are kitchen assistants, housekeepers, counsellors, complementary therapists. So there's a huge range of different roles that we offer at the hospice. So really just about how we can tie in best where the demand is, and if there's any volunteers who are healthy and able to volunteer, is there any particular roles that they'd be really well suited for and help to make the biggest difference.
Thank you, Lucy. Sally, do you advice?
Well, we're collecting details, as you know, Lucy, because I think we've been corresponding about this, haven't we? And thanks for coming on the webinar. Yeah, we're collecting details of people who are looking for volunteer roles and trying to point them towards trusts who might be looking for volunteers with those skills. So the more trusts that can put themselves forward as to make it public that they're looking for volunteers with skills, the easier it's going to be for us to match people and make sure we're not inundating the wrong people with help. So
yeah, do you just have someone to raise a hand here? Gillian, you want to speak?
Yes, I think it was just to talk about the RVS a little bit more, some feedback that I'd had. I've tried to apply for, well, essentially pharmacy drivers as part of our targeted recruitment, that role. At the moment, we've had some success at doing that independently to support cancer patients in the community. But I'm part of a community hub, public health for East Sussex. So I've been getting some feedback from other adult social care services who've tried to use the responders service, and it's been a bit patchy. I think maybe that's been answered already, but there was an issue that came up about potential financial exploitation around safeguarding, which I think is of concern, that an NHS responder was asking a client for their bank details, and it's just worried about what sort of safeguarding training is in place for your responder volunteers.
Thank you, Gillian. I think any questions or comments about RVS, we will have to have a separate webinars because there's quite a lot.
Okay, thanks.
Yeah. We do have some. Yes, Alison.
Oh yeah. Again, happy to answer that question. Is it Gillian? If you give.
Yes.
Yeah, no worries.
Yeah. I'll shall I email you some questions, or?
Yeah, you can always post on the forum the questions, Gillian, and then Alison can share the questions so everyone can see as well. If that's okay.
Okay.
With you.
Yeah.
We have some few minutes, but so we can go back to the questions here for Eloise. Eloise, can you unmute yourself? They have a question from Jessica. How do you manage social distancing in a volunteer hub?
Yeah, so right now, basically the volunteer hub is kind of got 2 closed doors, and it will always have someone from the volunteering service in it. So they, you basically have to ring the doorbell so they know when you can come in, and basically they'll make sure there's enough space. And when people come in, you aren't allowed anything that you've had basically on the wards. If you've had any gloves or anything, all of that should have been taken, you should have left that on the wards. And they get people to wash their hands and things. So there is someone kind of like manning the door. Chelsea's quite lucky in the sense that their hub, they have got a kind of space with doors on it, so you can manage that flow in and out, a bit like when you go to Tesco and stuff. Right now there's a person on the door making sure we're staying apart, so it's just one of their volunteering team or one of their experienced volunteers who's helping in the office, who's kind of managing that right now. But appreciate as the numbers increase, they may need to find slightly larger spaces. So like the canteen, for instance, is being given up to sort of volunteering as a staff hub. So
I see.
Yeah.
And the next question is, how many volunteers does Jersey and Westminster have, both normally and available to work on site now?
Yeah, so I don't know the original 100% like number, but it was a couple of hundred were on the books. Unfortunately, now there's only about 50 previous volunteers that are able to continue working out of that original cohort. But over the last sort of week and a half, 160 new volunteers have been processed, and we're going to start them in cohorts of 10 from today. So again, that number will increase, and probably, they basically run a morning and an afternoon shift at Chelsea, and each time there's about 10 volunteers at both sites.
And the next question is, will volunteers at Chelsea be offered C-19 tests?
COVID-19 test. Yeah, so again, this is part of the conversations that are ongoing. So we're basically going to treat them the same as staff. So if they fall in the same parameters of staff, like showing symptoms and whatever, then they should be able to access the test as well. It's a slightly separate conversation just in terms of how Chelsea are managing their tests for staffing. But yeah, the principle is the volunteers will get the same as the staff.
Wonderful. And are you recruiting experts volunteers formally medically qualified, and how do you fast track them?
Yeah, so that is a slightly separate process. So any volunteers that we have come in where we see they have any previous clinical experience, we pass them over to there is specific HR team that are processing clinically trained return to work staff, and they've got their process down to 3 days, a 3-day turnaround on those staff. So anyone that comes in wants to do clinical, we've handed them over to them. They get processed within 3 days. If they don't want to do clinical work or go on to bank or anything, then they get handed back to the volunteering process, and we'll go through that, which is, I mean, technically we're giving ourselves a 14-day process, but we're getting people through in a couple of days down to the speed at which DBSs are coming back.
Perfect, thank you. And what is the capacity in Jersey Trust Volunteer Service team?
So this is one of the things we're mainly focusing on right now. So the team is 4 core people. Obviously, as I mentioned earlier, Joe unfortunately is off sick, so they have got a number of their experienced volunteers kind of helping in the office. So there's kind of 1 or 2 regular volunteers helping with day-to-day admin and helping do telephone interviews. But again, Chelsea's been quite lucky in the sense that we've managed to get some finance staff redeployed to help us with the onboarding, who are currently having to work from home and can't perform their normal role. So they've probably got about 4 to 6 extra kind of support people at this time, and not necessarily all full time. But yeah, so the core team is 4 people, but they've got about 4 to 6 additional sort of helpers.
Perfect. Thank you so much, Eloise. I think that's all the questions for Jersey and Westminster. We still have a few minutes left. Anyone want to have a final feedback or any questions for the groups? Do raise your hands.
We've had quite a few questions about the NHS Volunteer Responders scheme and how people access it if they're looking for a supply of volunteers quite quickly, and whether there's a catch-all answer that somebody could give for that. Is that something you could help with, Jane?
From my understanding, the volunteer responder scheme is not about providing a sort of a group of volunteers to help out organisations in quite the way that I think that's been asked. It's about one-on-one support for people referred to the service. So as Alison said earlier, it's done on an individual basis. I'm not sure if there's any plans for that to be different in.
Hello.
Okay. And just to say, and I think this is where the confusion. Sorry, can you hear me?
Yes.
Where the confusion has come in is originally these volunteers were very much about supporting that 1.5 million that was sent those letters around self-isolating. And then it has extended to more other vulnerable groups that social services and local authorities are worried about. But the primary impetus for this volunteer program is really to support those most vulnerable in our community rather than more general volunteering. But to say that, you know, if there's volunteers that are interested in some of those patient discharge roles and the wider sort of NHS transport roles, we have opened it up in that respect. But it certainly shouldn't replace for other bits of volunteering that's going on in the NHS or in the community.
I think it's probably also worth mentioning, you sort of referring back to what we said at the start of the meeting about where you're looking to recruit volunteers, to email us to let us know so we can share that more widely, because we have had quite a good response from corporates, and some of these people come with quite good skills and training. So I mentioned the British Airways cohort, Marks and Spencers. If you let us know, we can point those people in your direction as well.
Thank you, Mark. We have Emma Bourne here. Emma, do you want to speak? Emma, do you want to unmute yourself?
Hi, can you hear me? Hello. Hi, everybody. Fantastic webinar this morning. Thank you very much. I'm here with Sharon Ellswood, who is head of the volunteering team at South Warwickshire Foundation Trust. One quick question, and I know it's been touched on, but how have people managed to process the occupational health declaration statement, or declaration form effectively and quickly? Because our HR team obviously are dealing with an enormous amount of OH forms from bank staff and other applicant, new people joining the trust as such. They're trying to get it through as quick as possible, but it's the one bottleneck in our system is getting our OH forms through. And obviously it's a traditional problem with all our volunteering and even in normal times. I just wondered if anybody got whether they're doing anything different at this time to make this process quicker. That's what I'm trying to ask. I'm sorry.
Of course, Emma. Anyone want to answer that question, please? Can you raise your hand? We got Jessica here. Give me a second.
Is anybody using a volunteer declaration?
Hi, it's Jess here on occupational health.
Yeah.
We are planning to start using an occupational health self-referral form, and we've put our form together based on a form which the volunteer service manager at King's College NHS Trust shared with me. So it's basically rather than people submitting all of their information and vaccine records to occupational health, it asks them whether they've had vaccines and whether they have any kind of health condition or disability that might need some further support. And if they haven't had the vaccines or if they do need extra support, then we will link them up with occupational health. We're waiting for sign off from the exec board on that, but that's our intention to kind of streamline the process. I think a number of trusts do already use a kind of self-referral model, whereas we traditionally have made all volunteers bring certificates as well, and that's one of the big delays for us.
Is that helpful, Emma?
Yes. Yeah. Sorry. Hi. Very helpful indeed. Yeah. That is that is helpful because that's what we're looking at doing, is having, putting together a volunteer declaration statement, which they sign and hang in. And also really like the earlier input regarding the COVID-19, hang on, sorry, I'm just looking at my notes, like a disclaimer form. I thought that was also extremely helpful and useful. So we'll be using that tip. That was great.
Yeah, disclaimer.
Thank you very much.
Thank you. So just before we finish, I just want to let you know, on our Learning Zone, we have updated with loads of information how to streamline your recruitment process. And we have an example from the Royal Marsden that's been shared by Barry Whitmore. Thank you so much, Barry, how he fast-tracked with recruitment. So if you can visit the Learning Zone in the COVID-19 era, you can find all of the information to help you with your fast-track recruitment. Mark, are you still there? Would you like to wrap it up?
Yeah, so thanks very much, Fee. And I think it's been really excellent webinar today, some great contributions. And thanks, Alison, for stepping in and taking on all the RVS related queries. I mean, you can only imagine the challenges that are faced with that massive recruitment and processing of 750,000 volunteers, particularly when the call was for 250. So I think they're doing a fantastic job, and it's bound to take a little bit of time, but I'm sure it'll work really well when it's all fully on track. Really, just to thank everybody, and just to mention that next week's webinar, we've got BTS Spark are running a personal resilience session as a webinar for us. So I think that's probably something which everyone can relate to. So I know there are V's circulating details, and there are details on the website about that. And just to thank Jane for everything she's doing as well from NHS England point of view, in terms of making sure that the guidance that's coming out is relevant and addresses the concerns that you've all got. It's a hell of a task that she's got on, and she's really concerned to make sure, really concerned to make sure that the concerns that are expressed in fora like this are reflected in the guidance, and I think that's that's working well. My final two reminders are just, if you again, the email network@helpforce.community, let us know if you're recruiting, so that we can pass on people who come to us. Secondly, the PwC piece. So Eloise is part of the PricewaterhouseCoopers team who's at Chelsea and Westminster trying to support their volunteering resilience. Let us know if you want to be part of that and work through the volunteering resilience checklist with us, and possibly get some additional support from PwC or other consultants. If you email us that as well, that would be helpful. And as I say, the Helpforce Assist website is there to match offers from corporates to requests from NHS Trust. So you can put your requests on there, and we're trying to channel all of the corporate offers of support there, so everyone can have sight of those and access those.
Thank you so much.
Good luck, everyone. You're doing just fantastic job in incredibly difficult circumstances, but really appreciate the support that you're all giving each other. And V, as usual, is putting up a quick feedback form so that we can make sure that these webinars continue to be tailored to your needs. So thanks very much, everyone.
Thank you.
Thanks, everyone. Thank you. Bye-bye.
Bye.
Bye.